السلايدات واضحة؟
نعم دكتور.
اوكي، فاحنا موضوعنا اليوم Child Psychiatry. رح ناخذ هاي المحاضرة والمحاضرة القادمة. As usual, the objectives would be to expect factors that influence clinical presentation when dealing with child psychiatric disorders. Then we will classify child psychiatric disorders, classify learning disability. Yani this topic will be within this lecture. Other disorders will be in the next lecture. Recognize the clinical significance of learning disability and evaluate the role of attachment. Some points to start with, that in child psychiatry we are dealing with a being, a human being that is not fully developed, is still in continuous development. It is not living alone, living with caregivers, with family, and the child usually does not complain. The family complains from disturbances in child behavior. So what factors that influence the presentation, the clinical presentation? The age, development. Child is a developing being. He passes in stages of development according to theories of mind that we have studied last year, according to the dynamic stages of development, the cognitive stages of development, and these stages will influence the clinical presentation, at what stage the child is presented. The gender، يعني بالأطفال يعني عدما يعني أكثر psychiatric disorders تعتقدون بالmales أو بالfemales؟
Males.
Males, yes, exactly. يعني the situation in childhood is different from adulthood. In adulthood, females are predominantly affected by psychiatric disorders, while in children there is male preponderance، وهذا يعني إلى عدة أسباب. يعني قسم من عدها هي يعني some of the disorders are neurodevelopmental, and neurodevelopmental conditions are more among males because male pregnancies are more vulnerable to complications at pregnancy, birth, and after birth. The situation، يعني some clinical conditions appear in situation while not present in other. يعني some symptoms appear within the family while do not appear when the child in school, for example, or vice versa. We need to look at family, and the condition that the child is suffering from is influenced by the family interaction, the relationship between parents, the siblings, the interaction between siblings. The child does not come to psychiatric consultation by itself. Usually the child is presented by the family members, and the child cannot verbalize. يعني because of the development is still in a process, the cognitive development, the language development. So the child may be not able to express internal experiences like emotions or thoughts. So the manifestations appear more in behavior. So in this way, how can we conclude about the symptoms and signs؟ برأيكم شنو الطريقة إذا الطفل يعني ما يقدر يعبر عن نفسه، فشنو الطريقة اللي ممكن يعني نستنتج من عندها وجود الأعراض؟ أكو طريقة ببالكم؟
behavior.
وطبعا هذا البيهيفير شلون نشاهده احنا؟ يعني شلون نسهل مشاهدته؟
من يلعب مثلا،
yes play activity drawing.
يعني
أو يا أصدقائه شلون يتصرف.
نعم.
أو نسأل إنه ينفذ تاسك معينة مثلا.
دكتور عن طريق الرسم؟
ممكن الرسم. يعني احنا يعني ما صارت فرصة ان يعني بهاي الظروف ان تجون للمستشفى، احنا عندنا child psychiatry unit وبيها play room، غرفة بيها ألعاب وبيها ممكن يعني أوراق أقلام ملونة، ممكن يرسم، ومن هذا الرسم يعني ممكن يرسم شخصيات يعني تمثل العائلة أو اللعب. ممكن نعطيه يعني يعني ألعاب بسيطة يعني ممكن يلعبها من هذا اللعب. يعني أيضا راح ينطينا شخصيات يعني والتفاعل اللي يصير بالعائلة أو الخبرات اللي مر بيها الطفل، وهذه تكون مفيدة لغرض التشخيص والعلاج أيضا، يعني for diagnosis and treatment، لأنه هذه راح تعطينا thoughts، راح تعطينا emotions that can be corrected therapeutically. يعني الcognitive behavioral therapy مثلا ممكن تطبيقها بالأطفال بهذه الطريقة. Now, classification of childhood mental disorders. We have the emotional disorders، وهنا نقصد بها الانكزايتي، الفوبياز، depression، post traumatic stress disorders. عندنا البيهيفيرال syndromes، وهنا هذه تشمل الكوندكت disorder. راح نعرف في المحاضرة القادمة what do we mean by conduct disorder. attention deficit hyperactivity disorder أو ما كان يسمى سابقا hyperkinetic child. developmental، هنا عندنا developmental disorders تشمل specific reading writing developmental disorders أو تكون pervasive. for example على pervasive developmental disorder هو childhood autism. عندنا المنتال subnormality اللي كانت سابقا تسمى mental retardation وحاليا يسمى learning disability، يعني كتعبير يعني أخف تأثيرا من الناحية العاطفية learning disability، يعني أسهل على الناس أنه نقول صعوبة تعلم مما نقول تخلف عقلي. يعني مثل لما نقول الهانديكاب ونقول those with special needs. فهذه هي يعني main clinical syndromes that we might face in clinical practice in child psychiatry. عندنا المنتال subnormality أو learning disability، وهنا يعني we have a problem with the intelligence, the IQ, the intelligence يعني minimum level of intelligence that is considered normal هو 70. For those who are between 50 and 70 IQ يعني are considered mild learning disability, they can care for themselves and they can arrange their domestic activities. بس يعني they may find difficulty when face problems and may need guidance with them. وممكن يعني المايلد learning disability ممكن حتى يشتغلون أعمال بسيطة، يعني non-skilled laborers، أعمال ما تحتاج مهارة. تشوفون يعني إذا تروحون يعني بأي مكان، أي دائرة، أي مستشفى، تشوفون دائما يشتغلون يعني موظفين خدمة. They run their life, but when they face problems in their life, in work, in relationships, they can even get married. But when they face crises or stress, they can show behavioral disturbances, irritability, agitation, emotional problems such as anxiety and depression. But they can run their own life. As I have said, under stress, they need guidance and help. Those with moderate learning disability, IQ between 35 and 40, they need some supervision in their daily needs, in their eating, their bathing. They need care. They cannot run their life without help and support. Severe learning disability between 20 and 35 need close supervision and self-care, may show other neurological disturbances such as epilepsy, while those with profound learning disability, they need very close supervision. Usually they do not develop speech and they are vulnerable to disturbances in behavior more than the other types. The causes of learning disability. شنو برأيكم? What are the causes of learning disability?
دكتور داون syndrome.
Down syndrome, yes. بعد.
cerebral palsy.
Yes.
دكتور هي mental retardation يعني بشكل عام.
نعم. فإذا brain damage, whether prenatal, natal, postnatal, whether this is due to genetic.
دكتور hypothyroidism من ضمن
نعم. نعم. Whether this brain damage is caused by genetic factors or other biological factors. احنا اذا النورمال يعني الانتليجنس، يعني هسه اذا ناخذ مثلا 100 شخص ونسوي لهم اي كيو تيست، ونسوي يعني هذا الاي كيو تيست وي بلوت ات statistically، شلون يظهر الكيرف تتوقعون؟
دكتور بيل كيرف حوالي الافريج مالتهم.
Exactly, the Bell curve or the Gaussian curve اللي هو normal distribution curve. يعني in this curve يعني most of people are within 2 standard deviation. يعني 95% of people within 2 standard deviation. 2.5% have very high IQ. 2.5% have low IQ. وهذا هو ال continuation of normal distribution curve اللي هو most common cause of learning disability. يعني هنا هذا سببه يعني multifactorial. يعني usually the whole family is of low IQ, so that stimulation to the child is below average, and this will result in lagging cognitive development. such families of low IQ يعني in their lifestyle they do not run a lifestyle that is needed for healthy development. Their preparation for food, as I have said, the stimulation to within the family. So multifactorial points will result in lagging cognitive development and result in this low IQ. وهذا هو يعني low IQ usually within the mild range. When there is external cause, يعني external insult due to genetic or other biological factors within the prenatal, natal, and postnatal life, this will result usually to result in severe learning disability. وهنا عندنا الchromosomal syndromes such as the Down syndrome. As you have said, the Down syndrome هو the most common cause of genetically determined learning disability. عندنا other syndrome that we call the Fragile X syndrome. Fragile X syndrome اللي هي the most common cause of learning disability in males. Other genetic syndromes like inborn errors of metabolism, whether they are hereditary or they are resulting from mutations. Other environmental factors like injuries, illnesses, toxins, drugs during pregnancy, birth trauma, postnatal infections. The main example of postnatal or congenital infections هي torch infections. سامعين بها torch بالبيدياتريكس.
نعم دكتور.
Okay. اللي تشمل التوكسوبلازما، الروبيلا، السيتوميجالوفيروس، herpes. These can be congenital and can result in brain damage. Other يعني ممكن many other causes, meningitis.
syphilis سمينا.
نعم. وهذه كلها يعني may result in neurological syndromes beside learning disability. مثل ما قلت neurological syndrome هي manifestations مالتها هي cerebral palsy. طبعا neonatal jaundice إذا كان severe و not well treated, not urgently treated. Okay. What is the importance of learning disability? هنا عندنا behavioral problems. يعني such people are not equipped with the intelligence that is needed to solve problems. يعني وهدف الانتليجنس هو يعني to solve problems, so that people with learning disability when face problems they start to be under stress and may show disturbances in behavior, irritability, agitation, emotional symptoms that need special need of treatment and counseling with the family. And they are more vulnerable to all types of mental illness. يعني learning disability patients are more vulnerable to the emotional disorders, to the psychotic disorders, even to the bipolar disorder. They are more vulnerable than other people with average IQ. وهذا سبب يعني جانب من عنده سبب الستريس. They are more vulnerable to stress. وجانب آخر أيضا يعني it is due to the neurodevelopmental defects, the biological disturbances that may result in mental illness. In this way, the management will be to treat the underlying condition. يعني سبب behavioral disturbance شنو هو؟ يعني هل هو emotional symptoms؟ هل هو other mental illness? But treating the underlying condition. Don't miss emotional symptoms. يعني أبو learning disability ممكن يعني mild anxiety may result in agitation. Agitated behavior in learning disability does not mean that there is psychotic disorder. وهذا اللي يصير طبعا بالبراكتس انه they are misdiagnosed as psychotic. احيانا الموضوع كله هو يعني simple anxiety and treatment of this anxiety, whether through drug treatment or counseling with the family, is enough. Mild anxiety, mild agitation, mild depression may result in irritability and agitation in people with learning disability. Behavioral measures bring benefits. يعني when we are dealing with learning disability يعني ايش نقصد behavioral measures؟ يعني behavioral therapy. ايش نقصد بالbehavioral therapy؟ behavioral therapy تستند على شنو؟
تغير يعني البيسز مالت الكوجنيتيف behavioral therapy.
لا البيهيفيرال مو cognitive. behavioral per se اللي هي مستندة على behavioral theory of mind اللي هي شنو
يعني
هي؟
الثواب والعقاب يعني.
بالضبط عفوا reinforcement, operant conditioning. When there is adaptive behavior, this is rewarded by whatever the patient is interested with. وهذه تستخدم بالinstitutes يعني المصحات. يعني أحيانا بالsevere learning disability patients are kept in institutes in which patients are given coins for whatever positive behavior, and these coins then can be exchanged with food, with drinks, with whatever the patient is interested with. وهذا يسموه token يعني هاي العملات token economy. token 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 economy. فاحنا لما عندنا مريض يعني عنده مشكله بالاي كيو يعني we cannot deal with thinking. يعني thinking is very primitive او concrete يكون يعني concrete thinking. we resort to behavioral measures اللي هي تستند على reinforcement وال operant conditioning. Okay. Another important subject is maternal deprivation. وهذا الموضوع هو موضوع attachment that was described by John Bowlby, the attachment theory. Attachment theory, which simply says that the child is a growing creature that needs protection, physical and emotional care in order to grow. If this care is not present, this will result in attachment problems. So the child needs an attachment figure. هذا attachment figure يعني usually is the mother and father, but actually any caregiver can provide this role. and bring secure attachment. So the child needs warmth, needs stable relation, and this warmth and stable relation with an attachment figure will determine future relationships. When the child is not provided with the secure attachment figure, may grow up being insecure, has suspicions about self and others, and may show disturbances in behavior that might continue until adulthood. This attachment is important in the first 4 years of life. فهي يعني ببساطة إنه يعني عندنا كائن ينمو، يعني حاله حال أي كائن آخر حي، يحتاج إلى رعاية، يحتاج إلى حماية، يحتاج إلى اعتناء بالصحة البدنية وحماية من المخاطر، يعني خلينا نقول physical dangers and the threats, in order to grow with a healthy self-esteem, self-confidence, and trust to other people, so that he will grow developing a stable ego. And this stable ego is important in making balance within the self between the different compartments of the mind. Causes of maternal deprivation simply may be separation due to death, divorce, or illness, when the caregiver is not able to provide the needed protection, or just it is lack of warmth. يعني قد يكون البارنتس هم موجودين، يعني physically existing but emotionally distant due to their problems, due to their personality problems, due to their continuous concerns about their personal needs while neglecting the needs of the child. In short-term deprivation from an attachment figure, the child first starts to show protest, يحتج, crying, irritable. Then comes a stage of despair, become want to be withdrawn, wants to be isolated, showing lack of interest. And if this continues, there will be detachment from the surrounding. Here there will be little reactivity with the surrounding, that is reflecting the state of emotional coldness. هذه يعني هذا short term deprivation, if stopped, there will be readjustment. وهنا the child may show initial rejection to interaction with the caregiver, or apprehensive clinging, يعني the child is having conflict with the caregiver that is separated from, so he may cling to the caregiver, but in the same time he is afraid. This is in comparison to long-term deprivation. In long-term deprivation وهذا اللي يصير بالresidential setting، يعني الأطفال اللي يعني يعيشون بالملاجئ. أو broken home. هنا يعني هذا long term deprivation اللي هو يعني will result in a state of detachment, and this detachment continue for a long time, and then the child may show antisocial behavior. شنو يعني antisocial behavior؟
يعني ما يحترم القوانين.
بالضبط، يعني will develop low tolerance to rules, low frustration threshold, together with lack of guilt and remorse. وهذا يؤدي يعني إلى anti social behavior اللي يظهر بالبداية كسكول تروانسي، بعدين يتطور إلى ممكن substance abuse, criminal behavior، وهذا هو اللي نسميه conduct disorder، اضطراب التصرف، واللي راح نتحدث عنه بالتفصيل بالمحاضرة القادمة. طبعا poor cognitive development and poor emotional development. They show difficulties in school, and the emotional development, as I have said, they grow with insecure attachment towards others, so they may show difficulties in relationships in adulthood. So the presence of attachment figure that is able to provide care, emotional care, and physical protection is important for growth of healthy ego, for healthy interaction with others, for the presence of levels of tolerating frustration. If these are not present, the child may show antisocial behavior. وإذا ممكن الموضوع يعني أقل حدة, damage is less, they may show difficulties in relationships and in trusting others and in making secure relationships in adulthood. وهذه طبعا كلها لها further complications on mental health. اوكي، وهذه هي يعني المادة العلمية لمحاضرة اليوم. إذا عندكم سؤال أو تعليق بخصوصها.
دكتور هاي مال الكلينجينج ما فهمت شنو يعني.
يعني الطفل ورا فترة من الانفصال عن الكير جيفر، طبعا هنا نحن short term deprivation نقصد بها matter of weeks to months. إذا تستمر years نسميها long term deprivation. إذا الطفل الكير جيفر يعني يبتعد عنه لفترة أسابيع أو أشهر، لما يجي يشوفه مرة ثانية يعني يصير عنده conflict، يعني ما بين هو يريد يعني لا زال يريد يشوفه، يريد يعني يحصل على الدفء مالته، وما بين بنفس الوقت هو يكون خايف من عنده لأن هو ابتعد عنه. فكلينجينج يعني يتمسك به يعني، بس بنفس الوقت هو خايف من عنده.
اوكي واضح.
هي يعني هذه هي بها تفاصيل كثيرة، يعني أنا ما ردت يعني أدوخكم بها. يعني إذا تحبون تطلعون عليها، نظرية بالبي واحدة من النظريات المشهورة يعني بالسايكولوجيكال development of children. يعني أكو أنواع من ال attachment disorders that may result from separation from attachment figure، بس أنا اختصرت لكم إياها. يعني هي إما يتطور عنده يعني with long term deprivation، إما يتطور antisocial behavior يعني lack of well grown ego، أو يعني insecure attachment اللي هي تؤدي إلى difficulties in making relationships in adulthood. ماشي، اكو اسئله بعد؟ تعليقات، ملاحظات؟
دكتور العفو، كنت قد بقى كم محاضرة إن شاء الله؟
نعم.
كورس سايكاتري بعد كم محاضرة ناخذ؟
خليه اوقف الريكورد.